You're sitting in the doctor's office, staring at a lab report. One number is circled in red. PSA 7.2.
What?
Suddenly, the
Wait, I
room
have
feels
so many
smaller.
questions.
Your brain
What
starts
is
screaming
going
one
on?
word over and over: cancer. But wait, before you start planning your retirement in a panic, I have a secret the statistics don't always tell you. According to the Cleveland Clinic, about 75% of men with an elevated PSA score do not actually have cancer. That's right. 3 out of 4 men are worrying for a reason that has nothing to do with the C word. So, if PSA isn't a cancer test, what on earth is it measuring? And why is your number so high? Today, we're going to look inside the prostate and discover why your walnut might just be having a bad day. Hi, I'm Dr. Euro. Let's clear up the confusion and lower your stress levels right now. PSA stands for prostate-specific antigen. It's a protein made by both normal and cancerous cells in your prostate. Think of your prostate like a sponge filled with this protein. Normally, it stays inside the sponge. But when the sponge is irritated, squeezed, or inflamed, the PSA leaks out into your bloodstream.
Fire!
A high PSA reading in your blood
Everybody
is just
get
a
out
smoke
of the
alarm.
corridor.
It tells us there's smoke, but it doesn't say if it's a fire. Or just someone burn a piece of toast in the kitchen. Both set off the alarm.
Finally,
in this video,
here it is,
we'll explore the
PSA cheat
burnt
sheet.
toast of the
Let's go through
urology
the
world.
key indicators
The things
and
that
guidelines
trick
for
your
prostate-specific antigen testing.
Meet Percy
Hi,
the
Ved.
prostate.
I'm
He's
so
small,
glad you're here.
he's sensitive, and he's about to explain everything. To understand why Percy leaks PSA, we first need to look at his day job. He's not just a walnut for show. His main task is producing fluid that nourishes and protects your little swimmers, the sperm. He lives right under the bladder, wrapped around the urethra like a tiny, fleshy donut. As men age, Percy tends to, well, let's just say he likes to expand his territory. This is called BPH, or benign prostatic hyperplasia. It's a big name for a simple thing, an enlarged prostate. According to NIH, BPH is extremely common. About half of all men between 51 and 60 have it. When Percy gets bigger, he has more cells. And more cells mean more PSA being produced. It's like a factory adding a second shift. Naturally, the total output, the PSA in your blood, goes up. This isn't cancer. It's just more normal factory workers making the same normal protein. But growth isn't the only reason. Sometimes, Percy gets angry. This is called prostatitis. Prostatitis is an inflammation often caused by a bacterial infection. Think of it like a prostate flu. When inflamed, the walls between Percy's sponge and the bloodstream become leaky. PSA spills out in huge amounts. During an infection, your PSA score can spike into the double digits. If your doctor sees a spike, but you also have pain or fever, they'll usually treat the infection
That's
first.
wonderful news.
And check the PSA again later. Spoiler, it usually drops back down once Percy calms his temper. But wait, sometimes Percy leaks PSA not because he's sick or old, but because he's been manhandled. Welcome to the world of PSA Cheaters, daily habits that can trick your blood test results. First up, the bike seat. For Percy, a long bike ride is like being sat on by a giant for 2 hours. The pressure on the perineum physically squeezes Percy, forcing PSA out into your system. Harvard Health notes that vigorous exercise, especially cycling, can temporarily boost your PSA levels. Next is a sensitive one, ejaculation. When Percy works his day job, he releases a massive wave of PSA. If you have sex or masturbate within 48 hours of your blood draw, your numbers will likely be inflated. It's not cancer. It's just PSA's after-party molecules still lingering in your bloodstream. Then there's the digital rectal exam, or DRE. If your doctor checks the prostate physically before the blood draw. That gentle poke can be enough to bump your score up. Always do the blood test first. Even a simple urinary tract infection, UTI, can stir up enough trouble to make your PSA scream fire. So, if you've been cycling, having fun, or fighting a cold, your 7.2 might actually be a 2.0 in disguise. To get a clean reading, PSA needs 48 hours of peace and quiet. No bikes, no gym, no fun. Just think of it as a mini vacation for your walnut before his big moment at the lab. But what if you did everything right and the number is still high? Don't panic, there's one more tool. It's time to talk about the free PSA ratio. Think of PSA in your blood as having two different states. Most of the PSA is bound. It's attached to other proteins like it's wearing a pair of handcuffs. But some of it is free, floating around solo, completely unattached, and living its best life. Here is the secret. Cancerous prostates are stingy. They produce more of the bound, handcuffed PSA. Normal or just enlarged prostates, BPH, are more generous. They release a higher percentage of free PSA. So, if your total PSA is high, your doctor will look at the percentage that is free. If your free PSA is over 25%, PSA is likely just growing old or a bit inflamed. No big deal. But if your free PSA is below 10%, that's when the smoke alarm starts to look more like a real fire. Mayo Clinic often uses this ratio to decide if a biopsy is truly necessary or just a waste of time. Using this one extra number can save thousands of men from painful, unnecessary procedures every year.
I really appreciate it.
Think of it as a truth serum for your blood test. It clears the fog created by the total PSA score. But Dr. Euro, Bob asks, what if my ratio is low? Is it game over? Not at all, Bob. Even a low ratio doesn't guarantee cancer. It just means we need a better camera.
To test it.
We've moved past the dark ages of jumping straight to needles. Now, we use magnets. Welcome to the age of the prostate MRI, the high-definition movie of your inner walnut. In the old days, if your PSA was high, doctors would do a blind biopsy, basically throwing darts at a map. But now, we have the multi-parametric MRI. It doesn't just see the prostate, it sees through it. It looks for things like blood flow and water movement to see if a spot is suspicious or just a scar. The results are given in a score called PSA, ranging from 1 to 5. PSA 1 or 2. That's like a clear weather report. Even with a high PSA, the risk of serious cancer is tiny. This is the get-out-of-jail-free card. Many men can stop right here and just keep an eye on things. But what if it's a PSA 4 or 5? Now we have a specific target. No more throwing darts. We use MRI fusion biopsy, where the MRI map guides the needle directly to the suspicious spot. It's much more accurate and often requires fewer samples, which means less discomfort for you. Bob is starting to realize a high PSA isn't a sentence, it's just the start of a logical investigation. But wait, there's one more thing that can make PSA levels stay high for years without any danger. It's called PSA velocity, the speed at which your number changes over time. If your PSA is 6.0 and stays 6.0 for 5 years, that's much safer than a 2.0 that jumps to 4.0 in 6 months. Trends are often more important than the single number
As you can
on
see, the
today's
scores
lab
trended up
report.
here in late 2025, but with the new treatment plan, we see a complete normalization.
So, before you panic,
how does this
ask your
align
doctor,
with the
what has
three-year
been my
strategy
trend
we
over the
discussed?
last 3 years? Knowledge is power, but preparation is peace of mind. Let's build your PSA shield before your next lab visit. Rule number 1, the 48-hour peace treaty. From this moment on, PSA needs zero interference. That means no cycling. Those professional-grade bike seats, they are PSA's biggest enemies. No heavy squats or vigorous lower body workouts at the gym either. Let the pelvic area rest. Rule number 2, absolute celibacy for 2 full days. No ejaculation, no exceptions. We want PSA's day job molecules to be completely cleared from your system before the needle goes in.
See
Rule
these
number
icons,
3,
Bob?
check for
They
the quiet
indicate
fire.
everything is
If you
perfectly
have
fine.
any burning while peeing, tell your doctor.
That's a relief, Doc.
A hidden infection will sabotage your results. It's better to delay the test than to get a false alarm.
We'll
Rule
start
number
with the
4,
needle,
the order of
followed by the
operations.
gloves.
If you're getting a physical
Ensuring
exam,
we follow
do the
these
blood draw
steps is
first.
crucial for patient safety.
Don't let a gentle poke during a DRE turn your 1.5 into a 4.0 before the lab tech even arrives. Rule number 5, hydrate, but stay consistent. Extreme dehydration can sometimes concentrate your PSA. Drink your normal amount of water. We want a standard version of you, not a desert dry version. And finally, stay calm. High stress hormones like cortisol don't help your body stay balanced. If you follow this checklist, you aren't just getting a test, you're getting the truth. Bob is now ready. He's got his checklist, his trend report, and his peace of mind. While Bob waits for his results, let's talk about the long game. How do we keep PSA happy for the next 20 years? It turns out, PSA is a huge fan of Italian food. Well, specifically, cooked tomatoes. Tomatoes are rich in lycopene, a powerful antioxidant that studies suggest can lower prostate inflammation. Harvard researchers found that men eating 2 or more servings of tomato sauce a week had a lower risk of prostate issues. Next, PSA needs his minerals. Zinc is like the security guard of the prostate cells. Pumpkin seeds, oysters, and legumes are great sources to keep your cellular defenses strong. And don't
Looking
forget
good,
the green
broccoli.
shield. Cruciferous vegetables like broccoli and cauliflower are PSA's best friends.
Yeah!
They contain sulforaphane, which helps your body detoxify and protects DNA from damage. But what you don't eat is just as important. PSA hates processed sugars and excessive red meat. High sugar leads to insulin spikes, which can act like fertilizer for unwanted prostate growth. Outside of the kitchen, PSA needs you to move. Walking 30 minutes a day keeps blood flowing. Preventing the stagnation that can lead to chronic inflammation and that dreaded PSA creep. Stress management is the final piece of the puzzle. Chronic stress keeps your body in a state of high alert. When you're stressed, your muscles tighten, including those around PSA, causing unnecessary pressure. By eating right and staying calm, you're not just lowering a number, you're building a fortress. Let's recap. The prostate is small, but its impact is huge. Early detection is the only secret you need. 1. Screen at 50. 2. Eat your tomatoes and broccoli. 3. Face the fear, because knowledge is survival. Men often ignore their health to protect their families, but the best way to protect them is to stay healthy. If this video helped you understand your body better, hit that subscribe button for more health doodles. And give us a thumbs up to help this message reach more men who might be ignoring their walnut. Do you have
Well,
questions about
now,
prostate health?
that's an
Drop them in the
interesting
comments below.
combination.
We read them all. A quick reminder, this video is for educational purposes only and is not a substitute for professional medical advice. Always consult with your physician or a qualified health provider regarding any medical condition or symptoms. Never disregard professional medical advice or delay in seeking it because of something you have seen in this video. Want to learn more about your health? Watch our video on the science of sleep or the sugar trap next. Remember, your health is your greatest wealth. Take care of your walnut. Thanks for watching. We'll see you in the next health adventure. Bye for now. Channel signature sound.